Very good evening, friends. Meeting again in the session of philosophy. We are discussing regarding the Kant's philosophy. And today we are going to start with new chapter. That is the chapter number 36 from Kant's philosophy. The second prescription. We have learned a lot while learning the degree course. That what is second prescription? We know the definition that when first prescription has acted and whenever you give the prescription later on, it is called to be a second prescription. This is what we know. But how one should go ahead? What should be your second prescription? It depends upon the remedy reactions. And that's why earlier lectures, the 4 lectures we have learned the remedy reactions as explained by Kant. And then on the basis of those remedy reactions, we define our plan of or our further plan of the treatment. So how to go ahead? There are basically 3 varieties of second prescriptions which can explains over there, and those are very, very important. So here we have to start with the chapter. In the first sentence only, he explains about the 3 important ways of second prescription. So we'll start chapter number 36, the second prescription. The second prescription may be the repetition of the first, number 1, or it may be an antidote, number 2, and number 3 is a complement. So either you are giving same remedy in a different potency. That is a first thing which you have to take into consideration. If the state remains to be the same, the patient comes to you, patient has relieved with your remedy, but state is same, it is not changed, and patient is still not completely cured. Then you have to go for little bit high potency, and then you have to think about the same remedy in different potency. So repetition of the same in a different potency is the first aspect which you have to take into consideration. And this happens whenever the 4th type of remedy reaction is there. That is generally no aggravation at all. So patient feels better after taking the treatment and patient is comfortable, and again he is having the similar types of symptoms, and then the state remains to be same, and then you have to go for same remedy in high potency. The second which he explains over there is an antidote. So when time comes when you have to antidote, you think you have just learned the remedy reaction. So in which type of remedy reaction it is necessary to be aggressive and immediately antidote? The first type of remedy reaction, that is the long continued aggravation with final decline of the patient, it is too much necessary to antidote that action. Number 2 is whenever there is medicinal aggravation takes place. So the symptoms, new symptoms added in your after giving the medicine, and that creates the problem is the second, whenever you have to think about antidoting the remedy. And third important thing where you have to antidote is the symptom takes the wrong direction. That is 12th observation. So those are the things where you have to be very cautious, on the guard, and you have to antidote. And third is very important. That is the complementary remedy, using a complementary remedy. So when to use complementary? For example, you had a case, a chronic rheumatism, now presenting you as an acute state. He is having very typical joint pain, swollen, because the weather has changed. It is the rainy weather. Patient has had a joint pains and patient becomes so restless. He is not able to move. Whenever he moves, he feels better, but change of position aggravates. During the rest, he gets aggravated. The tongue is absolutely retive, and you had given the Rustox. With Rustox, he felt better, but his rheumatism is there since long time, chronic. Rustox is the remedy which is acute enough, which never covers the whole story. And then, in order to tackle his chronic background, the miasm, then you have to complement the Rustox. Then you have to look for complementary where the Calcarea carb is complementary to the Rustox, and you can give the complementary as a complementary to the Rustox, a Calcarea carb. So in such types of cases where you would have got certain results with acute remedy, but patient still remains in that state, or his chronic problem is not yet settled, the complementary remedy relationship plays a very vital role, and you have to make it use the complementary. If the patient you have treated with acute episode of acid peptic trouble, but he is having it since long time, so you would have treated him with Naxomica with very fine results, but it is recurring and it is since long time. There are three complementaries to the Nux. There is a sulfur complements to it. There is sepia is complementing, or third is Kalika. Three remedies from three different miasms are there. Depending upon your case, you have to complement. If some patients might need sulfur, some might need the Kalika, some might need the sepia. So this is what is the second prescription, and this is the view what he wants to explain to you in this specific chapter. So let us go ahead what he says further. But none of these things can be considered unless the record has been again fully studied, unless the post examination and all things that have since arisen have been carefully restudied, that they may be brought again to the mind of the physician. So you should not immediately go for the complementary. You should not antidote it immediately. First, go through the case. What are the things which are covered up? What are the things which still remains? Whether the patient, in which direction it has gone. So you have to look towards the all observations which he has told. This is one of the difficulties to contend with when the patients change doctors, and one of the reasons why the patients do not do well after such a change. Here Kent is very specifically saying, if patient is going on changing doctor from one homeopath to another homeopath, the another homeopath never knows what the first homeopath has prescribed. If the patient would have feel better with the first homeopath certain degree, then second homeopath doesn't know what the first homeopath had given, and symptoms, or he takes a wrong direction. So it is always better to remain in one doctor. The strict homeopathic physician knows the importance of this and will try to ascertain the first prescription. If the former physician is strictly a homeopathic physician, is the most competent of all other to make the second prescription. It is often hardship for patient to fall into the hands of second doctor, no matter how much Matra Medica he may know. The medicine that has partly cured the case can often finish it, and that medicine should not be changed until there are good reasons for changing it. See how nicely he is explaining over there. If this fellow turns away from you, you would have done a better for him. But still, he is not satisfactory. Then he changes the doctor, and another homeopath doesn't know what you would have given. If that fellow is a good homeopath, he will ask that patient that it's better to be there with the first physician, because he would have cured you half of the way. He knows what medicine is given, and he will definitely cure him. But those types of conscientious physicians are very less on this earth now. So it is rather difficult to go for it. So this is the problem, and that's why what Kent says over there, that this fellow must remain with the first homeopath only, and that physician will definitely do a better for him. Another important thing which he has mentioned over there is very important. What he says, the medicine that has partly cured the case can often finish it, and that medicine should not be changed until there are good reasons for changing it. If one remedy is acting and patient is having it since long time, that patient sufferings are there, but it has proved that your remedy is working, but it is a little bit slow because the disease is already chronic, but patient doesn't have that patience to wait. If patient becomes impatient, the problem arises for him. If he is patient enough, then he will definitely get cured from it. And second thing which he is mentioning over there, if the remedy is working, it is acting in proper manner, there is no need to change it immediately. It is a very common thing for patients to come to me from the hands of good prescribers. I tell them to stay with their own doctor. I do not want them. Such changing is often detriment to the patient unless he brings a full record, and this is especially true in relation to the case that has been partially cured where the remedy has acted properly. If the patient has no reasonable excuse to leave the doctor, it is really a matter of detriment to the patient for a physician to take another patient's at such a moment. It is not so much a question of ethics. It is not so much a question of relation of one doctor to another, because friends can stand all that. But it is only after tedious inspection of all symptoms of that intelligent physician is capable of making a second prescription. See how nicely he has mentioned. If you get such type of patient from the another homeopath, and you know that first homeopath would have already done good thing for him, and part of it has worked very nicely with that fellow. So if it has worked, then your duty is to tell him that be remain with the first physician, because in recent future he will give you a right prescription and you will be cured. Instead of taking whole story again and finding it out or another remedy, and it might spoil your case. It is better to tell him directly, conscientiously, that you remain with that fellow, because that fellow knows what he has given and how the remedy has worked. As a general thing, if the first prescription has been beneficial, it ought not to be left until it has done all that it can do. So, if you would have given one remedy, if you would have given Calcarea cough to the patient, and it is making benefit, it is going in right direction. Only the progress is little bit slow, but he is going in right direction. Then the things are that you should not change the remedy immediately. If the state defines the same remedy, you go from 30 to 200, 200 to 1M, 1M to 10M, 10M to 50M, 50M to CM, like that. You can. This you can follow, but you should not change remedies so frequently if the remedy is doing well or remedy is working well in that case. How is the second physician to know that? Then the duty of physician is first to the patient and pursued the patient to the return to his first doctor. So very specifically Kent says, you must send that patient to the first doctor who knows what he has given and what remedy he has given and how to follow it. The rule is, after the first correct homeopathic prescription, the striking features for which that remedy was administered have been removed. A change has come, and the guiding symptoms of the case have been taken out. The and only common and trivial symptoms remains. It is true, if the physician would wait long enough, he would see the return of those symptoms. But usually, when a patient walks into the doctor's office, the doctor is in a hurry to make a prescription and does not wait until the proper time. He at once prescribes on the symptoms that are left, and this is one of the dangers to be avoided, a hurried second prescription. The patients are to be pitied that fall into the hands of such homeopaths. Many patients are wonderfully benefited by the first prescription. They have said to me, Dr. So and so benefited me wonderfully for a while, and then he did not seem to be able to do me any good. The fact was that the first prescription was a correct one, having been properly chosen, and after that first prescription, doctor administered his medicine so hastily and so indiscriminately that nothing more was accomplished in the case. So he is explaining very nicely that if the first remedy was working properly and if you would change it very fast, then you spoil the case. Then the question of disturbance comes. But if your first remedy is acting, the better solution is always to keep your hands off. Keep the patients more and more on placebo, wait for the result, or continue with the same remedy with higher potency, with placebos, and look for the results. If you don't go on changing the remedy in such a manner, then you will definitely make a good for the patient. But if you are in a hurry, then you can make or you can spoil the case. The trouble was that he did not wait long enough. It makes no difference whether the patient is so extremely conscientious that he does not want to give Saclac, or whether he is so ignorant that he does not know how to give it, and result is the same. So better solution in such types of cases is giving the Saclac. But what Kent says, there are two types of physicians. I have seen a few physicians who never give the Saclac also. They give 3 doses, wait for, and they says there is no need of taking the medicines further. Meet me after a month. But this is many times patient feels he has given me only 3 doses. How can this will do a good for me? Patient should feel that he is taking the medicine, and better is to give the Saclac. But if you don't know how to give the Saclac, then problem arises. Then there is a need to give the Saclac, that powder form medicine. Put a 1 or 2 globules which are on which the drop of alcohol is already put, and then you give that doses to the patient and ask him to take 1 dose daily, or give the globules which are in which the alcohol has been poured, and give it to the patient and tell him that you take these 5 pills in the morning and 5 pills in the evening. Giving a Saclac gives the feel that patient is taking medicine. The early repetition of the medicine and the continued giving of the same medicine will prevent anything like an opportunity for making a second prescription. So if you go on repeating the remedy without knowing why do you repeat, can make a difficulty in making a second prescription. If the doctor administers well chosen remedy and repeats it too soon, he never gives the symptoms to a chance to come back and call for second prescription, but they become intermingled with drug symptoms so that the rational second prescription cannot be made. The second prescription presupposes that the first one has been a correct one, that it has acted, that it has been let alone. If the first prescription has not acted curatively or has not been permitted to act full time, it is impossible to get a second observation. See, very important thing is that to first you would have given a remedy. You should be watchful and careful. See whether it is working or not, whether it is acting or not. If it is acting, in which direction it is acting. You should be a you should have a big patience. Being a homeopathic physician, you should have a big patience in observing the actions of the remedy. If you know that first remedy which you have given is acting properly, then it is a type to keep your hands off. Never repeat the remedy. You have to look for what is going on. The second observation is made when the case comes to a standstill. For after the first prescription has been made, changes occur. There is coming and going of symptoms, and while these changes are occurring, no rational observation can be made of the case. If a second prescription be made during this time, it will be likely to spoil the whole case. So sometimes it happens that some patient's symptoms which goes and recur again, they are coming and going. Or sometimes it happens that they are not getting completely cured. You should not be in a hurry to immediately make second prescription. First take down the details, observe what is happening, whether your remedy is doing well or not, whether it is producing a proper action or not, and think before making a second prescription. Think first whether it is necessary to repeat or not to repeat. think first whether to give another remedy or not. So basically logic and thinking plays very vital role in making the second prescription. But if these precautions are not up, if the patient is not given a perfect rest, if medicines are not kept out of the case, we will have no opportunity to make a rational second prescription. But if these precautions are observed, then we can really make an observation upon the return of the original symptom, which is first thing to be considered. Perhaps they are not so marked, but that is always the first thing to be looked for, the return of the original symptom. While the confusion is going on after the administration of the remedy, while internal order is being established in economy, we do not have the return of original symptoms. So, if you would have given right remedy to the patient, one should not get the return of symptoms. If you find that there is a return of the symptom is happening, it means your remedy has not completely made a cure. Your remedy has acted, but still it doesn't have reached to that specific level. Then it is a time when to think about the second prescription. And then he says, while the confusion is going on after the administration of the remedy, while internal order is being established in the economy, we do not have the return of the original symptoms. This may be a matter of days or weeks or months, but if return of the symptoms is not observed, what is there to be done? So if there is no return of the symptoms, if the things are going in right direction, what to do? So best thing is that to keep your hands off, give give the patients more and more placebos and just go on observing what is happening. Without symptoms, what can the homeopathic physician do? No matter what state the patient is in, what can be the physician do without symptom? There is no earthly guide to the remedy except by signs and symptoms. So that it is duty of physician to wait for the return of original symptom. So if there are no symptoms, don't go for giving the remedy unnecessary. Look for the symptoms. If they comes, then there is need to repeat. If the symptoms return somewhat as they were, differing slightly in their intensity, increased or decreased, it is good. If the patient has had, if the patient has not had these present symptoms for some time, if there has been relief caused by the first prescription and then symptoms return somewhat as in the original, this is one of the reasons for believing that first prescription was good one. So here he is explaining over there that whenever you would have given a first prescription and patient symptoms have vanished, there is no recurrence of the symptoms. It is not coming back. It indicates that your remedy is working. Your remedy is doing well. There is no question immediately to change the prescription. If the patient has not had these present symptoms for some time, and if there has been relief caused by the first prescription and then symptoms return somewhat as in original, this is one of the reasons for believing that the first prescription was good one. If after an interval of 2 or more months, the original symptoms returns, we need very little information beyond this to know that the first prescription was good one. In such a case, when the symptoms return, when the patient has the same generals or particulars as formerly, it means that the first prescription was good one and that the case is curable, that the second prescription must be a repetition of the former. So now he explains that this is the time you can think that patient might require the second prescription and that is nothing but the same prescription in the higher potency. This is the time when you think that return of the symptoms are there and state is still same. It is not changed. There are no new symptoms added. The same state comes and it appears over there. Then it is the time to wait, to think about the second prescription. So these are things which he mentions over there, and this is the first time to think about the second prescription. So we should have a patience enough during making a second prescription. If you try unnecessarily and repeat the medicine or give it in higher potency, or if you change the remedy in a hurry, that may spoil your case. And that's why what he says over there, you should not be in hurry. You should wait. If the remedy is acting, you should remain with the same remedy for some time. Make it completely act and then think about it. So I think it's better to stop over here. We'll meet again on Monday. Today evening, we'll not have a lecture, not possible to conduct. So we'll directly meet on Monday's session for this Organon and as well as Materia Medica session, where I will going to start with next group of remedies, that is carbon group. So we'll meet on Monday's session. So thank you and good evening.
Thank you, sir. Have a good evening.
There was one question, sir. Can we find thermal state of the patient? Where? Yes, definitely. Thermal state is important. Always important whenever you are dealing with the patient. Only thing is that you have to look for thermals in which whether patient is absolutely chilly. Yes, it does. It has a significance. If it is absolutely hot, that also has a significance. So two extremes are there, then you should not take. If a patient is absolutely chilly and you are giving the sulfur, it's wrong. If patient is absolutely hot and you are giving soranum, you should not. Where we can find, that is actually, where can we find? It is given in Materia Medica. Every remedy you can get it over there. With the modalities you can understand. With the elements from you can understand whether the patient is chilly or hot. So that you can get over there. Okay. So we'll meet on Monday. Thank you.
Thank you, sir. Have a good evening.
Thank you.